Well, this year's been tough for state employees and teachers. 2 revenue failures at the state capitol spelled out fiscal hardship for many agencies around our state. But tonight, a silver lining. News Channel 4's Allie Meyer has more on a brand new program that allows state employees to have surgery free.
Surgery is expensive, even if you have insurance. In America, nearly 90% of patients plan for their surgery. They prepare for their recovery and for that bill. But the trouble with that is medical pricing is unpredictable. Some say corrupt. Price varies wildly from one facility to the next.
There are many routine things that people need, surgeries, tests, and there's just no reason why we can't let people know what that cost is going to be up front.
And there is a sense that it's not fair patients have no way to compare prices, like we compare costs and value in every other area of life. Imagine going to a store with no posted pricing. Sounds confusing, right? Compounded by the price changes when you go to check out, depending on who's paying the bill. There's one price for those who don't have insurance, another price for those who have private insurance. Also, there's a price for patients with Medicaid and a different price for patients who have Medicare. And when it comes to surgery, the difference isn't peanuts, but thousands of dollars, enough to push a patient into bankruptcy.
We believe everybody ought to attach a price to what they do and be judged on the value that they deliver and they create.
There is a movement in Oklahoma brewing about a decade now, price transparency. It started with Dr. Keith Smith and the Surgery Center of Oklahoma and has expanded to more than 50 facilities across the state. They bundle the bill, an all-inclusive price, so patients can compare.
It's a win-win. I mean, all of the non-price gougers and all of the patients involved in this win. The only losers are the people that still are with medical pricing or trying to see what they can get away with.
There is a new player in the game this year, a big one. The state's largest employer group, state workers. 183,000 lives covered by the nonprofit health plan, Health Choice. Administrator Frank Wilson.
We're taking a very aggressive approach with the bundled payment trend here in Oklahoma. And we believe there's significant enough savings that it could be a real game changer.
If you've ever had a medical procedure, you know patients receive multiple bills from the facility, the physician, anesthesiologist, the lab, post-operative care, and sometimes many more. Health Choice Select providers have agreed to one price, one bill, bundled together. And it turns out that bundled bill is way cheaper.
What we're trying to do in developing the Select program is choose some of the more common procedures that are performed more frequently and that have the best opportunity for savings.
The state is saving big money, so they are passing along that savings to their members. If you are covered by Health Choice, if you choose to have your surgery at a Health Choice Select facility, you will pay nothing out of pocket for your procedure.
It's a great benefit to the member, as well as a great benefit in savings to the plan, to the state, and ultimately to the taxpayers for the cost of public employee health insurance.
The genre is nonfiction.
Janet Boyd teaches 2nd grade at Chandler Schools. She needed a full knee replacement earlier this year.
I have had no cartilage left, bone on bone.
Janet's orthopedic surgeon, Dr. Kevin Hargrove, chose Surgery Center of Oklahoma. And so Janet paid nothing for her major medical procedure. No copay, no co-insurance, no lab fees, nothing for home health care.
It's been shocking and it's been so exciting to tell people and their jaws drop. My jaw dropped because I never had heard of such a thing. How can something this intense be free?
Squeeze, squeeze, squeeze. There you
Janet could have had free post-op physical therapy as well at a Health Choice Select provider, but she chose to stay in Chandler and paid the regular charges covered under her Health Choice plan. Nothing has changed for other in-network providers.
This is at least some good news for teachers that are facing or planning medical procedures, that finally they're going to get rewarded for good decisions that they made about a provider they chose.
OCPA's Jonathan Small helped change state law so Health Choice Select could operate. 2 years ago, he helped Oklahoma County implement an identical plan. They were actually the first. The county has saved $1.7 million in health care costs so far. County employees have saved $250,000 in out-of-pocket expenses. That's about $2,000 per person per procedure.
When you think about it, that is going to mean, the difference between, for some families, being bankrupt or not.
Health Choice won't go out on a limb just yet and guess how much our state might save, but Dr. Keith Smith will.
It's a beautiful thing to watch the market work.
He believes Oklahoma could save $100 or $200 million a year, and state employees might get to keep an additional $30 million cash in their pockets because of all this free surgery.
With budgets like they are, other states are watching. I can't imagine that the state of Texas can sit back and watch Oklahoma do something this smart and not respond in a similar way.
As more providers get on board and more health plans move toward bundled pricing, our largest hospitals will be forced to join in the movement, driving prices down for all. Allie Meyer, News Channel 4.
And right now, there are 55 providers in the Health Choice Select network, and that list is growing. Health Choice will add to the network each quarter, with a big chunk coming on board January 1st. But right now, none of the Metro's major hospitals participate. We've called each of them to ask why. We know some are working toward bundled pricing. Their statements are on our website at KFOR.com.